Hello, everyone. Welcome to Talks on Tuesday for this October first Tuesday of the month edition. We are really thrilled to have this opportunity for our community to learn more about the work of the National Fragile X Foundation and to also help us better serve our communities of families who are learning about a diagnosis of Fragile X and all the different ways and resources and ways that we can support them through our work in early intervention. So today, next, Amy, if you don't mind, thank you. So what I'd like to do next before I introduce our presenters from the National Fragile X Foundation is to highlight a couple of the ways that our conversation today aligns with and supports your professional development as early intervention practitioners. So, and just one alignment with the Division for Early Childhood Recommended Practices, we have the family strand with competency number 2. Practitioners provide the family with up-to-date, comprehensive, and unbiased information. So we're going to learn some different ways that you will have the opportunity to expand your knowledge about Fragile X and the support of families and providing them that information. All right, next, we'll look at the knowledge and skills for service coordinators, the alignment there. The whole first strand is really on infant toddler development. And this is just, again, one way that the discussion today and your learning today will impact your ability to explain developmental delays and disabilities and their impact on children's development and learning to families, along with also just different ways of providing families resources that are in some of the other KSSC strands. And then next, we're also going to be deepening our work with the pyramid model framework today with the key practice of building partnerships with families. And that's some of the ways that we're going to be growing our practice today. All right, next, what I want to do is introduce you to your presenters from the National Fragile X Foundation. We have Robbie Miller and Amy Milunovich. So they're both going to tell you more about who they are, what brings them to this work, and then also, kick off and dig into this topic. So I'll go ahead and hand it off to Amy and Robbie, and they'll take it away.
Great. Amy, why don't you tell a little bit about yourself first?
Okay. Hi, everyone. So happy to be here. My name is Amy. I take care of a CDC-funded natural history study called Forward, now also called Forward March. There's a next step to it. I've been taking care of this study since 2015. And before that, I worked at various institutions, hospitals, clinics, doing clinical research. And so this is a really interesting field to be doing. I love it. I love the families that we work with. The community is wonderful. So yeah, so happy to be here.
Hi, everybody. I'm Robbie Miller. And I should tell you, Amy and I are both out in California. Amy's in Sacramento, where it's going to be about 110 degrees today. And I'm in the San Francisco East Bay, where it's going to be about 105 degrees. So we're going to try and stay cool. I've got the ceiling fan on. So I would like to just share that I have been involved in the field of working with kids with special needs for 50 years. And the first 25 of those years, I spent working in early intervention programs. I have nothing but the greatest respect for the work that you do. It is so important. And then the last 25 years, I've been with the National Fragile X Foundation. And we want to share some information about Fragile X with you today in case it is helpful in the work that you do. So let's go to the next slide. So again, we're with the National Fragile X Foundation, which, by the way, this is we're celebrating our 40th anniversary year. Started back in 1984 by co-founded by Dr. Rondi Hagerman, who was a young developmental pediatrician at a hospital in Children's Hospital in Denver, Colorado. And again, this is our 40th year, and Dr. Hagerman is still working in the Fragile X field. Let's go to the next slide. So Fragile X is many people will say I know about Fragile X, or is that's like Down syndrome, right? We like to emphasize that, well, yes, it is in some ways that it causes intellectual disability in many, if not most, of the individuals who have Fragile X syndrome. But it is not just a condition that causes intellectual disability. It has a variety of associated conditions and disorders, which we're going to talk about in more detail as we go through. Mainly, we're going to talk about Fragile X syndrome, again, the condition that causes intellectual disability, but we do want you to be aware that this is a condition that impacts or has the potential to impact multiple family members. First of all, we know of individuals, or rather, we know of families that have two, three, four, or more children, all with Fragile X syndrome. And we know of families where the uncles and aunts and the grandparents and many other members have a Fragile X associated disorder or condition. And those conditions are, in addition to Fragile X syndrome, what we FACS test, which is Fragile X associated tremor ataxia syndrome, which affects older males. Fragile X associated and females, excuse me, Fragile X associated primary ovarian insufficiency, a reproductive issue, and other carrier issues. Again, we'll go into more details as we go through this, but just to be aware that this is a fairly unique condition, and genetic counselors will often tell us this is one of the more complicated conditions that they deal with. Next slide, please. So these are the best estimates of the numbers, 1 in 3,600 males, 1 in 4,000 to 6,000 females, 1 in 151 women, carriers in the US, 1 in 468 men. It does impact all world populations. In fact, I have met individuals with Fragile X all over the world. My job takes me on a lot of global travel. I've met with them. I just recently met with Fragile X families in Shanghai, China, for example. So it is important to be aware that this is in the world of rare diseases, this is not an ultra rare. It is technically considered a rare condition by the US government, but it is not ultra rare as some of the conditions you might encounter in your work are. Next slide, please. So based on those numbers, we believe that approximately 50 to 100,000 Americans have Fragile X syndrome. Again, that is the condition that causes intellectual disability in males and many females. And then hundreds of thousands of people are carriers who are at risk for passing the mutation on to their offspring. And very importantly, developing their own Fragile X condition um, later in life. Next slide, please. So why are we meeting you today? Let me just okay that where it's the transcribed message. It was covering part of the slide. So why are we meeting with you today? Well, Amy's going to later be telling you about the work that we do with the CDC, but the CDC has asked us at the foundation to work on improving the participation of all Americans in the opportunities to learn more about Fragile X, to participate in research projects, and to benefit from the latest treatments. So awareness is always an issue. Now, things have certainly improved from when I began with the foundation in the late 1990s, and the joke was Fragile what syndrome? Nowadays, most people will have heard of Fragile X, though they may not be aware of the details of the condition as we're describing today. We want people to be aware that is a nationwide network of Fragile X clinics. and I'll go into more detail on a future slide about that. Um, we very, very importantly want people to be aware that if they have a child or you have a child in your program who has an undiagnosed intellectual disability or developmental delay, they may need to be screened for Fragile X, particularly if they have an autism diagnosis. And again, we'll talk more about that in another slide. Um, and so these are the points of why we wanted to meet with you today and why we're trying to meet with all the early intervention programs throughout the U.S. Next slide, please. So autism and Fragile X. This can get a little bit confusing. We know that there are many causes of autism and many causes probably yet to be discovered. But approximately 1/3 to 1/2 of all children with Fragile X syndrome do have some degree of autistic behavior. Now, my own kids do not have Fragile X syndrome, but they grew up with two friends who do. And 30 years on, they're still friends. One of those, both have Fragile X syndrome. One has Fragile X syndrome and autism. The one who has Fragile X syndrome and autism is essentially nonverbal, where the one who does not have autism, along with his Fragile X syndrome, communicates with me almost on a daily basis through text messages and emojis. So Fragile X is believed to be the cause in 2 to 6% of children with classic autism. And keep in mind, as I'm sure you know, as early intervention providers, that autism is a behavioral diagnosis, while Fragile X is a medical diagnosis, meaning there's a blood test. And that blood test tells one if they have Fragile X syndrome or a Fragile X carrier. And as the slide says, it is not uncommon at all for a child to be diagnosed with autism and later it is determined that the cause of that autism is Fragile X or vice versa. Next slide, please. So these are I'm not going to read every one of these bullet points because I know as early intervention providers, you're very familiar with these, but we just want you to be aware that these are the issues that can be, not always, but can be associated with having Fragile X syndrome. All of the problems that you see in development, in delayed development, may be present in a child with Fragile X syndrome. Next slide, please. Some of the behavioral issues, I think these are very important to be aware of because these are, it is not uncommon for these issues to be associated with the syndrome. Particularly anxiety, which is a very common issue. And in fact, many of the medical treatments for Fragile X syndrome are anti-anxiety medications and therapies. But you'll see all of the things that you probably see in the kids that you work with: hand flapping, difficulty with eye contact, though not always, not to the degree that you often just see in classic autism, but there can be the difficulty in eye contact. Kids will perseverate, they're distracted, they're shy, they can be impulsive, difficulty with transitions, tantrums, aggressive behavior, which becomes more problematic in adolescence and adulthood. In fact, at the foundation, we recently published new online content specifically directing aggressive behavior in adolescents and adults with Fragile X syndrome. And in that content, we do emphasize that if one sees that aggressive or self-injurious behavior in early childhood, now is the time to begin to deal with that rather than just thinking that this might be a phase that they're passing through. Next slide, please. Very important to emphasize the wonderful traits that kids with Fragile X syndrome can have. They can be very, very social and very friendly, have a great sense of humor. They use imitation as a learning skill. Um, have good memories. They can be very helpful. They want to make other people happy. And as I said, often have a very good sense of humor and like to laugh. Also, just a note here that um, girls in general are less affected than boys. Keep in mind that males have XY, so if the X chromosome is impacted, there is no backup second X as there are in females, as there is in females. Next slide, please. So speech and language is an important indicator when it comes to understanding how to address kids with Fragile X syndrome, things to be aware of, that there is going to be delayed development in expressive language. There's a lot of perseveration, repeating the same words over and over and over. A kid with Fragile X might say, you know, you might say, we're going out to the park in a while, and the child might say, going to the park. Are we going to the park? Going to the park? Going to the park? Are we going into the park? You know, they might say it dozens and dozens of times over and over. There's a real cluttered quality to it. The speech can be very, very rapid and hard to understand. So again, speech and language therapy, along with occupational therapy, are core interventions that almost all kids, if not all, benefit from who have Fragile X syndrome. They do improve over time. The learning curve is slower, but their language does improve, both expressive and receptive. Um, often therapists will use their skills in imitation or mimicking as a learning technique or a teaching technique. But overall, the receptive skills are typically much better than the expressive skills. So that really can vary from child to child. In fact, I should take this time to emphasize that the variation in kids with Fragile X syndrome is significant, from kids who are very, very profoundly impacted, nonverbal, aggressive behavior, to kids who we know kids with Fragile X syndrome who hold down regular jobs, and we even know a few who have learned to drive a car and have a driver's license. So that kind of tells you that there is great variation. Okay, next slide, please. Again, things that I'm sure you see all the time in your work: the low muscle tone, challenges with hand-eye coordination, both in gross and fine motor. There's delays in all of the self-help skills. Through the work of that Amy's going to talk about with the CDC and the increase in evidence-based information. For example, we now know that most kids with Fragile X syndrome will eventually become toilet trained. However, it will be, in many cases, significantly delayed. That's really important for parents to understand, as they may think that their child's never going to be toilet trained and they simply give up. Uh, um, uh, and so we want them to understand that they need to continue to work on toilet training, work with the therapist on all of the associated skills, because the self-help skills, particularly toileting, as I'm sure you understand, are very important for for the parents to and the family to be able to function in a typical way. Next slide, please. These are some of the medical issues that we see in some kids with Fragile X. Not all. Again, not all kids with Fragile X syndrome, for example, have seizures, but a significant percentage do. But these are medical issues that have been seen and are or may be related to having the syndrome. Next slide, please. So, how does this get diagnosed? Well, there is a blood test, a DNA blood test that is better than 99% accurate in both males and females and diagnoses both the full mutation. The full mutation is what causes Fragile X syndrome, and the pre-mutation, which people who have the pre-mutation may develop FAXTAS or FAXPOI or one of the other associated conditions, disorders. It does require a blood draw, um, and this can be done. Many families will try to determine if they have a Fragile X mutation or pre-mutation, preconception. Parents who want to know if they are a carrier or not, particularly if there is a known family history of Fragile X or a known family history of intellectual disability. Um, but it is more common that the test takes place when families begin to see delay in development in the early years, the years that of the kids that you work with. This test is ordered by a doctor. And again, it is very, very accurate. Okay, next slide, please. So this becomes a little bit problematic. Health services in the United States vary wildly from state to state and from people who have insurance to those who do not and everything in between. Um, we know that the test can cost a family as little as $100 and be up to $1,000. So we really, really encourage, if you are working with a family and you are encouraging them to get tested for Fragile X, that you want to emphasize that they need to understand what the cost will be before they have the test taken. We don't want any sticker shock. Nonetheless, we think that it's important that they be tested. But you may, if you have a social worker as part of your program or someone who assists with this kind of thing, help them figure out what the cost would be in advance. So Amy and I did a presentation for the Federal Head Start program, and they were very interested in this because, as you can well imagine, a lot of the low-income families in Head Start, and I've worked for a couple of Head Starts, and I understood this, wouldn't even consider the test because they would be concerned about the cost. So do what you can do if you're encouraging a family to have the test for Fragile X, work with them in advance to understand what the cost would be. Thanks. Next slide, please. So why is diagnosis so important? Well, I've been emphasizing a lot of those points already, but I think it's worth going over them again. So a child who is diagnosed with Fragile X syndrome, a genetic counselor will always get involved and identify through pedigree who on the family tree is at risk for having a Fragile X associated condition or disorder and who should be tested. And as I mentioned earlier, it can lead to 2, 3, 4, 5, or more people in the extended family learning that they have a Fragile X mutation, whether it is the full mutation or the pre-mutation. Knowing that one has Fragile X rather than undiagnosed developmental delay leads to more consensus and evidence-based intervention. Over the past 40 years, quite a body of knowledge has been developed about interventions, therapies, treatments, medications, counseling, so on and so forth, that actually make a difference in working with individuals with Fragile X. Some of these things are things that work for all kids with developmental problems, and some are very specific to Fragile X. Knowing that Fragile X runs in the family allows a family to make the reproductive decisions that is best for their family. Okay. It allows, in today's globally connected world, it allows families to be part of that Fragile X community. When I started in the field, if someone had a diagnosed with Fragile X, they might go to their public library, and on some bottom shelf in the back, they might find one little reference to Fragile X and never meet another person who has the condition. Well, that's very different now, and people are on social media and attending international conferences and learning from one another. And knowing that one has Fragile X will allow families to decide if they'd like to be part of one of the many, many research projects that are going on around the world. And Amy will talk some more about that in a moment. So diagnosis is important. That's okay. Go ahead, Amy. Next slide. Um, Back in 2006, I think it was, I co-founded with a doctor the Fragile X Clinical and Research Consortium. We now have 34 U.S. clinics and maybe somewhere between 10 and 15 international clinic members. And these clinics, this is a consortium that the National Fragile X Foundation oversees. We just had a meeting of the consortium, for example, at our international conference in Orlando, Florida, last July. And these clinics all provide medical services, including medication evaluation and consultation. They all have a physician who is knowledgeable about Fragile X and the latest treatments. And they all have genetic counseling and can, if they don't have OT and speech and language behavioral therapy as part of the core part of their clinics, they have centers and specialists that they will refer families to. And many of the clinics participate in collaborative research efforts. Next slide, please. So here's a map. We've got to update this, Amy, to show our new Salt Lake City clinic, and there's a couple other little changes, but this is the clinic network in essence. Okay, next slide. So I went through our network of clinics and I identified what I think would be the clinics, since there is no clinic in the state of Virginia. These are nearby clinics, or relatively nearby. Washington, D.C., Cincinnati, Durham, North Carolina, Louisville, Kentucky. All have Fragile X clinics run by a medical doctor knowledgeable about Fragile X. So we've got all of the clinics also have a clinic coordinator who's usually the person who arranges the appointments. Some of the clinics do telehealth, some do not. Some see all ages, some only see up to age 18 or 21. It really can vary, but these would be the 4 clinics if you want to do a screenshot, or I understand these slides will be saved, so they'll be available to you further on. Okay, next slide, please. Amy, I think this is where you jump in.
Sounds good. Yeah, so I will talk about some great resources that the National Fragile X Foundation offers to families. And the first is this Fly With Me Fund, which provides financial assistance to families to be able to travel to a clinic to receive evaluation and treatment services. And so each family is eligible to receive a grant of up to $300 per family per year for travel. And this could be used for accommodations, food, childcare expenses. It can also be used to help pay for a clinic visit. Unfortunately, the funds cannot be used for Fragile X testing. So another valuable resource that is available to families are these community support networks. These are volunteer-led, parent volunteers that provide educational, emotional support to local families and individuals living with Fragile X syndrome. So this is a really important resource to have, especially for families that are newly diagnosed. As Robbie talked about, it can impact the entire family and extended family members. And so we do have a map on the National Fragile X Foundation website with all the support networks and the contact information. And there's also many other resources posted on the National Fragile X Foundation website. So I'll talk a little bit about what FORWARD is. FORWARD is a longitudinal Fragile X natural history study. It's been funded by the Centers for Disease Control and Prevention since 2008. And so data is collected from individuals that have Fragile X syndrome through Fragile X specialty clinics that Robbie talked about. They're part of this consortium. And each of the clinics that collect these data have to have IRB approval. So their institution needs to allow them to collect this information. So we think that FORWARD is the largest resource of both clinical and demographic data for the Fragile X syndrome population in the United States. So we have over 1,800 individuals enrolled with Fragile X syndrome enrolled in this database. And so really there's two components of FORWARD. Again, there's this longitudinal database, and that's where clinical and parent-reported data on individuals with full mutation Fragile X syndrome is collected from many clinics. Right now, I think we have about 22 clinics that are participating, and it's compiled into a central database and turned into a data set, basically. The other nice component about FORWARD is that it also helps advance Fragile X research. And so it can help identify individuals who may be eligible for a particular research study. And so then we're able to connect those families with researchers and facilitate that, the research process, so that it's a little bit more smooth and quick. So I think, let's see here. So one of the reasons we're here, so we wanted to share a breakdown of the race and ethnicity of FORWARD participants. So again, we have about over 1,800 participants with Fragile X syndrome who are enrolled. And so what clinics are letting us know is that if families are coming in, they're pretty okay to enrolling into this research study. So we think that this could be representative of the populations that we're seeing in our Fragile X clinics. And so like other studies, it's not just FORWARD, right? Minority enrollment is challenging. So as you can see, our non-Hispanic whites are over-recruited. Almost 75% of FORWARD participants are non-Hispanic white. And so I think our most significant recruitment deficit has been for Black families. There's about 8.1% in FORWARD compared to 13.4% in the US population. So we definitely have work to do there. For Asian population, so some research shows that perhaps roughly half of the Asian populations relative to white have the prevalence of Fragile X syndrome. So this could explain the 3.4% relative to 5.6% of the US population. We actually have been working really hard on our Hispanic enrollment, and we've made significant improvements there. We have a lot of Spanish material available. So right now we're at 8.1% enrolled in FORWARD. I'm sorry, 12.6% enrolled in FORWARD compared to 18.3% in the US population. So we're doing okay there. And so why are certain populations underrepresented in FORWARD? We're really not sure why some groups don't participate in Fragile X research, such as FORWARD, but we think it could be a combination of one or more of the following. So there could be a lack of awareness about Fragile X, so the families just may not know that what Fragile X is, and so they are never diagnosed. They could not know about the Fragile X specialty clinics, and so they don't come to the clinics, and they don't have the opportunity to enroll in Fragile X research. There could be financial burdens of getting tested or visiting a clinic, so that could be a factor. Also, skepticism about the benefits of research and how, their family can benefit. Also, skepticism based on historical abuses of minorities participating in medical research and misuse of research data. So some of these factors may be interconnected. We're trying to still kind of understand specific barriers so that we can better serve these underrepresented populations. So a priority for Forward is to ensure that the findings that we are getting out of this study really benefit families of all different races and socioeconomic backgrounds. And so this is why we're kind of doing this outreach with you guys. And so the goal of Forward is to reach a better understanding of Fragile X syndrome and to provide these evidence-based descriptions like Robbie kind of talked about of how the syndrome presents itself across a person's lifetime. This includes understanding co-occurring conditions, associated risk factors, service barriers, and certain needs. And so basically all of this data that we collect is generated into peer-reviewed journals. And so we have about 26 published papers currently from Forward. And so many of these published papers are then developed into family-friendly treatment recommendation documents, and these are also available on the National Fragile X Foundation website. So they're accessible to families, genetic counselors, clinicians, educators, and they can help create effective treatment plans and interventions to help reach more positive outcomes for people with Fragile X syndrome. All right, Robbie, I'll hand it back to you.
Sure. So, like so many nonprofit human service organizations today, we are now a virtual organization. We have staff members and volunteers spread across the entire country. Some of our staff themselves are parents of children with Fragile X syndrome, and we welcome people reaching out to us for information on looking for a treatment recommendation, for example, for help in finding the most appropriate clinic, learning about our next webinars or conferences. So the best thing to do would just be to go to fragilex.org. But you see, we also have contact@fragilex.org as the general email. We do have a Washington, D.C. post office box, but we don't have a physical office there, and as well as a toll-free 800 number. But I think the best thing to do is go to the website. We have an unbelievable amount of resources on our website. And feel free to reach out to us, particularly, I think, email. We also have quite a presence on social media, such as Facebook. So I'm not sure if we're going to do the Q&A first, or I think there are some wrap-up slides here.
Why don't we go ahead and do questions now before we do a wrap-up? You guys have left us some nice time to really be able to get some individualized learning support here. So
I just want to emphasize one thing, that neither Amy and I are scientists or doctors. So we just want people, we can't talk about specific medications or things of that nature, but we can give certainly some general answers and try to point you in the right direction of where you might find the correct answers.
Terrific. Yeah, that's wonderful. So if you all have questions that have been popping up as you've been listening to Robbie and Amy, please feel free to put those in the chat. We do have one question. Corey Hill has asked, do you know if underrepresented families participate in other research, or is it specific to Fragile X? Or are these kind of disparities in data collection, is that specific to Fragile X, or is it something you found that other research organizations are experiencing?
Well, I'll start, and Amy, I'm sure we'll have something to add to this. It is my understanding that in general, this is a nationwide problem when it comes to medical research, partly for the reasons that we stated in the prior slide, including the, historical misuse of medical data, lack of awareness, um, a whole variety of reasons. But this is not a problem, to the best of my knowledge, particular or specific to Fragile X.
Yeah, that's
Amy,
correct.
yeah, your experience too.
Yeah, it's definitely not just Fragile X. I think it's across, all populations, and there's a lot of outreach going. I think, with various studies, various conditions, disorders. Yeah, so
I'll add that I at one time had a consulting business, a rare disorders patient advocacy consulting business, and this problem existed in every one of the organizations. Yeah, it is not specific to Fragile X. I hope that answers the question.
Yeah, no, thank you. I have a question myself. For those of you who may not see me, this is Lorelei Pisha with VIPD. I have a question on, you all talked about the cost related to that the blood test is the way to diagnose Fragile X, and that it can be expensive. Are there resources or any supports in place, or places families can go to, or service coordinators can go to learn more about the cost and finding support for that?
That's a great question, and this bedevils us at times. Um, because of the somewhat disjointed nature of how medical care is provided in the US, there's no simple answer to that. And that's why we really want people to work, why a social worker or someone like that, we hope would get involved with the family to understand what the cost would be. I will say that it's certainly very helpful if a doctor orders the test versus a family going to their doctor and saying, I read about Fragile X, or I heard about Fragile X. I want to get my child tested. If a developmental pediatrician or other specialist actually puts in writing, recommend DNA tests for Fragile X, that can carry a lot of weight. Um, yeah.
Okay,
But
thank
I,
you.
I wish I had a better answer. In my global travels, I go to countries where people say, "Oh, no problem at all. The government pays 100%." Um, and I just wish that was true in the U.S., but it is not.
Yeah, no, and again, I think for early intervention, folks out there, it really, speaks to the importance of that, the collaboration and teaming that is involved in supporting families, and looking for ways that we can help families find those answers and navigate the costs.
Yeah.
Um,
I'm sorry, one more thing I want to add. We have heard that some hospitals do have different programs that they don't necessarily publicize really well, where they will provide no cost or low cost testing. So it doesn't hurt to ask about different charitable programs that exist at different hospitals or hospital related foundations.
Thank you. That is helpful. So we do have a question that just came in, or it says, I have a child on my caseload with Fragile X, and she's showing extremely challenging behaviors when someone is trying to assist her in completing an activity such as eating, as she's a stuffer. Is there any way that I can help? Mom feels frustrated.
Help mom feel what?
Mom's feeling frustrated, so she
Yes.
wants to be able to help mom.
And I assume this is a preschool age child
Early intervention, so under the age of 3. So we're
under
looking
the
at the
age of 3.
toddler. Mm-hmm.
Well, I would hope, first of all, that the family is working with an occupational therapist as well as a speech and language therapist and maybe even a behavioral therapist. So that kind of problem of mouth stuffing, for example, we hear about that all the time. Um, uh, so it's important for families to understand that they're not alone, and that the problem that their child is experiencing is not that unique. Believe it or not, that often makes families feel a lot better. We hear that all the time from families of newly diagnosed kids who come to our conferences and learn, oh, it's not just us that are having this feeding problem or this toileting problem or this behavioral outburst problem. And they understand that, begin to understand that A, things will usually get better over time. B, there are very specific interventions on our website. We have a number of what are called treatment recommendations. These are consensus and evidence-based, family-friendly documents that have been reviewed by the entire network of Fragile X clinics, that offer very specific intervention techniques for problems like that, like you're describing. So, not knowing the specific child, I'm not able to give a specific treatment recommendation, but it is really, really important for a family to understand that this is typical in Fragile X. They should be working with the aforementioned professionals, and that things will improve over time.
Yeah, and I did, and Corey's highlighting, wondering, asking the mother what she might say might be the best support for her and their family. And then I also noticed when I was looking through, though, so when Robbie and Amy talk about how extensive the resources on this website are, they're actually understating. As you guys have seen while they've been talking, I've been adding links in, but I did notice some really wonderful printable resources. So that could be really supportive for your team. Because Sarah, I see with your question, you're saying the child is getting OT and speech and has an annual coming up. So really kind of going in and digging into some of those resources that you can print and bring to the team might be really, really helpful. I'm really glad Sarah, that you were able to attend this session, hopefully bring some additional information to the team.
And just remember, as we noted in the slides, sensory issues are a big deal in Fragile X. So people who are knowledgeable about different sensory intervention therapies could be very helpful to helping a child with Fragile X syndrome, move forward and learn new skills.
Any other questions, you all feel free to post those. I have one more, and Amy, this might be directed more towards you. When it comes to helping families learn about and participate in Fragile X related research, is there a specific way that I know the website, is there a specific place you can point us to that service coordinators and practitioners can share with families to help them if they want to get involved and to understand the importance of it?
Absolutely. So we do have a page dedicated to not just forward research, but all kinds of research that's going on for Fragile X syndrome. So I can post that, and it has very detailed information about every project that we have, including forward and like the benefits of participating and things like that. So I can actually post that link.
That would be terrific. Thank you. And I'm just bookmarking these, and having these easily accessible can be the difference between a provider being able to share it with the family and not. All right, do we have any other questions coming in? And then Lisa just posted some of the resources that we have on our website, the Virginia Early Intervention Professional Development Centers, on supporting infants and toddlers and families with sensory integration, sensory processing disorder. We are also going to, when we post this recorded session and resources, we're also going to post a link to share with you all a prior Talks on Tuesday series that we did on genetic counseling, that we just want to make sure everyone is aware of and understands those connections there.
That's great. I mean, genetic counseling is so important to Fragile X. In fact, it is a core requirement that all clinics in our consortium must have genetic counseling available.
Perfect. It sounds like these clinics are very comprehensive. And again, you guys, we'll highlight, I'll pull out that particular slide on our webinar, the slide that it has the closest clinics there and any of those resources that are shared. I'll pull those out of the PowerPoint as well, and post those in our archive.
Hey,
Amy and Rob.
Lorelai.
Amy
It's
and Rob.
Corey.
Oh, great. Corey, go ahead.
Hi, everybody. Excuse me. I have a bad cold. I'm sorry. When Lorelai posts or shares that information on the two-part Talks on Tuesday on genetic counseling, if that's something that you're interested, it is important to know that the funding for those particular people who were called NEMAC, that funding has ended. I'm going to drop it in chat, or Lisa can, but the Center for Family Involvement, through the partnership where Lisa and Laura and I work, are continuing to connect families for genetic counseling. So if you're interested in watching that, just know that NEMAC has ended, but we still have support in Virginia with genetic counselors through the Center for Family Involvement. Thanks, Lorelai.
No, thank you, Corey. That's really important, because also we know that if families go in one direction, we send them to a resource and that's over, we risk the potential of them not being able to immediately be able to follow through with the next step. So knowing exactly where to point families is really helpful. Thank you, Corey. Amy and Robbie, is there anything in closing that you all would like to say that's popped up before I do a couple of informational slides?
I think I've said probably enough.
Thank you. It's all been useful. All right. Amy, do you mind going to the next slide then? All right, you all. So, as you all know, our talks on Tuesdays tend to be on the first Tuesday of every month. But our next talks on Tuesday is actually going to be on the second Tuesday, on November 12th, because of Election Day. So we want to make sure everybody gets out and votes, and then we'll convene after that. Our topic then on November 12th is going to be actually on Gestalt language processing and understanding how that kind of processing in young children impacts development and impacts some potential strategies and interventions that families can do. So you'll be looking out for a constant contact coming out on that shortly to be able to register, but just note that we are going to be a week in for that. Before we close off, if you'll go to the next slide, Amy, before we close off and I tell you exactly how to get your certificates, I did want to really thank Amy and Robbie for their continued advocacy and support and all of their work to really get this information out down to families in any venue that they can. It's been almost a year, I think, since we first connected, and have been trying to kind of work with them to get this information to you. So we really just want to thank you all. They are on Pacific time too, so this is like morning coffee time for them, but they jumped in and were able to support us. So we really want to thank them for doing this for us. As our Talks on Tuesday pros know, but we want to definitely make sure we explain it to those who are new to us. What you'll do in order to receive a certificate for your professional development contact hour, for this, you'll need to look in your inbox, sometimes your spam box, for an email from us that has a survey in it. You're going to open that survey, complete the survey, and then you will get your certificate of participation. And if any quirks come up, feel free to contact any of us at the EIPD to help you navigate that. All right, you all, we will sign off. But again, thanks everyone for attending, and find any of us the appropriate person if you have any questions on this topic or more Talks on Tuesdays. We'll see you guys after the election.
Thank you.
Bye, you all.